Hi, beautiful people. It's Danielle. I'm on call today, so I'm in the hospital, and I decided we'll have a little talk today. Yes, so I decided I'll let you guys know what it really feels like to be a doctor. From the time you're in medical school, anyone asks you what you're studying, and so when you say studying medicine, the person always gets excited and they always seem so interested. In you, they see you as somebody who is super smart, because once you can become a doctor, it means that you are smart and they would always be so happy for you, and most times we would just sit there and we'll feel a little bit uncomfortable, basically. Because yes, we understand that being a doctor is definitely a hard task. In becoming a doctor, you have to study a lot. You have to give up so much, sacrifice a lot. But at the same time, there's also a lot of responsibility that will be on you. So as much as people will in that moment, basically glorify you and see you as this amazing person because you can become a doctor, you yourself feel, a little bit anxious and a little bit scared of becoming a doctor because, of course, having the responsibility for someone's life is a big one. So far, from my experience as a junior doctor, as you guys know, I'm a house officer. I'm not specialized, but I currently work in ophthalmology department, which is the eye department. And it's nice. It's rewarding when patients come in with problems and you can help them, and their eyes actually get better and they see better. And so it's very rewarding. But at the same time, being a doctor can be very frustrating because, like I said before, that responsibility that's on you for a person's life or the person's quality of life is a great one. And you're at the end of the day, we are still human beings. So if something goes wrong in managing or treating a patient, we will feel very bad about it. And we might not necessarily show it, but we feel it. Especially during those times, when I was not in the eye clinic and I was on the ward and we were dealing with a lot of sick patients, even though you would do your very best for the patient, you will do everything that you can possibly do, even if it means that you stayed up the whole night and you did not sleep while you were on call and that patient dies, you still feel very bad about it, even though you know that you did your best because you're a human being and you have feelings. And being a doctor, because of that, can have a great effect on your mental health. Sometimes you would always question yourself, you'll always second guess yourself, you might feel depressed, you might feel anxious coming into work in the morning because you just never know what to expect. So as great as others may think it is, for us, it can actually be very depressing and can actually give us a lot of anxiety. And so the next thing that comes with it is that we have to sacrifice a lot, give up a lot of your personal time because doctors are always on call. So there have days when you have to spend an entire 24 hours in a hospital. There are times when you have to work weekends. For me, sometimes I have to work both Saturday and Sunday. Sometimes you get no days off for the week. So sometimes for that, it's a great sacrifice. You have to give up a lot of your time. Sometimes it's someone in your family's birthday and you would like to spend that time with them and you can't because on the day of their actual birthday you might have to work, and then on the weekend you might still have to work. So for that it can be very frustrating. And sometimes, even though you do your best for your patients, sometimes they might not fully appreciate it. And even though you really did do your best and something didn't go wrong, you will still feel people might come down on you, people might say all sorts of things about you, even though you did what you knew to the best of your knowledge to help them. And that can be frustrated. But on the same note, there are patients that will show you so much appreciation, even though everything didn't go perfectly, but they would appreciate your effort and your time and how much they saw that you cared about them. And there are some patients that will go as far as, to even give you little tokens of appreciation. And these patients, they actually help us to feel more confident, and they help us to get up in the morning and to come to work because we know that there are people out there that do appreciate all the work that we do. And I'd just like to say thank you to all those amazing patients that show us as doctors appreciation for all that we do to help. And next thing for us that can be frustrating at times is when different persons might call and they will tell us something over the phone and they would expect us to know exactly what is wrong and to be able to help them there and then. But the thing is, multiple conditions can present with similar symptoms. And the only way we would know exactly what problem that you have is if we physically examine you and do certain tests to know exactly what the problem is. And some persons, when they call for help and they don't want to go to casualty or they don't want to see a private doctor, they expect us to just know what is wrong. And we wouldn't just like that. We have to at least examine you and do certain investigations to know. And some people might even get upset when we say, oh, well, go see a private doctor or go to casualty, but we are actually acting in their best interest, because you can't really diagnose someone without examining them and doing certain investigations. So yes, there are many other challenges that we face, but those are just a few, just a few of the challenges we face as doctors, especially junior doctors. But at the end of the day, it is a rewarding job. You feel so good when you can actually help that patient, when you can actually save someone's life, and you can actually improve the quality of life for someone. That is one of the most amazing feeling ever. And I think that is what gives us the motivation to get up every day and to come to work despite the many challenges, the anxiety, and the depression that we face. It's just knowing about those occasions where we actually can help and to improve the quality of life for others. That is just a feeling that makes us feel so good. So yes, I just want you guys to know, a little bit of what we face as junior doctors. So I hope you guys have a good day. Bye, and I'll see you in my next video.